4th Primary Sense Lunchbox session. Today we'll focus on how to identify patients without evidence of bowel and/or breast cancer screening using Primary Sense. My name is Harry Howe and I'm the Senior Project Officer here for Primary Sense at Gold Coast Primary Health Network. Gold Coast Primary Health Network would like to acknowledge and pay respects to the land and the traditional practices of the families of the Yugambeh language region of Southeast Queensland and their elders past, present and emerging. Just some housekeeping before I do start today. This meeting is being recorded, so it may be shared as a resource later. So please keep your cameras off and mics muted. There will be an opportunity at the end of today's session for questions. So please either populate the chat with any questions throughout the webinar or at the end, ask your question while we'll stop recording. Bowel and breast cancer screening in Primary Sense. In the Primary Sense tool, there is one current report, which includes patients aged 50 to 74 years without evidence of bowel and/or breast cancer screening completed in the past 2 years, noting that not all screening data may be sent to the GP. Table 1 shows male patients who are eligible for bowel cancer screening, whereas Table 2 shows female patients eligible for breast cancer screening and/or bowel cancer screening. It's important to note that in these two reports, patients recorded as active in the practice software are included. So this excludes patients marked as inactive or deceased in clinical software, being medical director or best practice currently. Here is a screenshot of the Primary Sense dashboard. As you're aware, if you do click on Reports from the Primary Sense desktop application, this screen here will appear. Once this screen here appears, please double click on bowel and/or breast cancer screening to open the report. This report will then open by default in your default browser. No further actions are required and/or filters. What you can see now on your screen is an example of the bowel cancer screening in Primary Sense. This is males patients eligible for bowel cancer screening. As you can see here from left to right, we do have the patient name, the patient phone number, when the patient last visited the practice, existing appointment. This here will show you when the patient is booked in to visit the practice again. We then have the GP name of the patient, the age of the patient, smoking status of the patient if recorded, alcohol status of the patient, then also the obesity status of the patient, i.e. yes, no. If we go across to the next slide, this is an example of female patients who are eligible for breast cancer screening or bowel cancer screening in Primary Sense. As you can see here, very similar to the previous report, you do have the patient names, the patient phone numbers, when they last visited the practice, existing appointment. So this here will show you when the patient is booked in to visit a practice again. We then have the GP name, the age of the patient, smoking status, alcohol status, obesity flagged as yes, no, and/or screening. The screening column indicates which screening the patient is currently eligible for. You will see also there is this first column here which says remove. You can remove a patient from appearing in this report for the next 12 months or so if you wish. If you simply click on remove, this patient will be removed from appearing in the report for the next 12 months. Very shortly, I will stop sharing my PowerPoint slide deck and give you a live demonstration of this Primary Sense report in action, from opening it up to applying filters once the report is opened. And just a reminder, when a document or report is opened in Primary Sense, a folder is automatically created on the computer in use. If the end user on their practice clicks on Documents and then Primary Sense folder, as you can see here. If the end user then double clicks on the Primary Sense folder, they'll see there's two folders. One, Quality Improvement, and the second folder is Reports. Within the Reports folder, that will include any reports that the individual on that computer has downloaded from Primary Sense. Likewise, any quality improvements templates downloaded from Primary Sense will automatically be saved to this quality improvement folder by default. So you can open any reports or quality improvement templates at a later date. What I'll do now is share my screen with you all. So what you should see now is the Primary Sense tool on your screen. If I click on reports, just like this screen here does appear. These are all the reports that an individual can open in Primary Sense. Today, we're looking at bowel and breast cancer screening. So I'll simply double click on that report. As you can see now, this shows me that the report is currently downloading from Primary Sense and will very shortly open in my default browser. For me, that is Google Chrome today. As you can see here, this is the bowel and breast cancer screening report in Primary Sense. You have the name of the report at the top. Where it says demo here, this will be populated with your practice name. Today, we are using demo data, hence why it says demo here. It will then show you the date and time when this report was downloaded. These 4 aqua boxes here can all be ticked and expanded. So if I click on this first one, which patients are included in this report? This will show me which patients are currently included in this report. So I know patients in this report are aged between 50 to 74 years without evidence of bowel and/or breast screening completed in the past 2 years. Noting not all screening data may be sent to the GP patients. And patients with related interventions, e.g. colonoscopy, are not included as they are likely already known to the GP. And like I was saying previously, patients marked as active in the practice software are included in these reports. I can also click on what data is in this report. How do we use this report? If I scroll down here, male patients eligible for bowel cancer screening. If I click on information about this table, it will give me further information about this table in particular. A little trick I do like to apply in Primary Sense, by default, it will only show me 25 patients per page. So as you can see here, there's a total of 12 pages or 283 male patients who are eligible for bowel cancer screening in my dummy data. What I will do is select show me all patients per page. Now I see all of my patients on this one page, which is much easier for me to filter through them. And now if I go from left to right, I can see all the male patients eligible for bowel cancer screening appearing here, their phone numbers, when they last visited the practice, existing appointment, who their GP is, age, smoking status, alcohol status, and also obesity flag, yes or no, which is all extracted from the clinical software, being medical director or best practice. Any of these headers are also able to be filtered. So if I want to see of my patients who are eligible for bowel cancer screening, who's coming in the next few days, if I simply click on this header here, just like that, it'll document and show me all the patients. So I can see that this first patient here is coming in on the 23rd of October. Their GP is Dr. F. Robinson. They are 51 years old. Smoking status is no. Likewise, if I wanted to sort this list by patients whose smoking status is yes, I can see all the X patients first, so X smokers. I keep scrolling down, followed by N for non-smokers, and then down to non-applicable. so patients don't have that recorded in the clinical software. Likewise, I can filter for any of these by clicking on the headers. So for alcohol status, who has a high risk? So that could be a targeted intervention I do at the practice. I want to target males who are eligible for bowel cancer screening, who have a high risk. If I scroll down, the second report, as I was saying previously, is female patients eligible for breast cancer screening and/or bowel cancer screening. This report here is very similar to the one above, but like I was saying, this is for females only, and this is for breast cancer screening and/or bowel cancer screening. Like before, you can click on any of these headers here to sort. And you will see also screening. So this will show you what screening the patient is eligible for. So for this first patient, S. Anderson, I can see that she is 74 years old and she's eligible for bowel and breast cancer screening. Whereas if I go down to T. Kelly, I can see T. Kelly's mobile number, when they last visit the practice, when they're booked in again to visit the practice, who their GP is, age, I can see the smoking status, alcohol status, etc. And I can see that she is due for bowel cancer screening. Once again, this report here will only show you 25 patients per page. So what I can do, once again, show all patients per page. And very similar, you can click more information about this table, which will show you more information about this table and which patients are included. There's also the option with Primary Sense to directly export any report you wish to an Excel or CSV document. I'll show you an example of that now. If I click on Export to Excel, you can see there it is being downloaded. I'll click Close here, and I'll double click on the Excel document. You can see it's currently downloading. And now you can see for Primary Sense bowel and breast cancer screening, I can filter any of this also in Excel, which I will show you now. With this report here also, you can save it to your local desktop at the practice, or you may wish to save it to the practice server, so other practice staff, whether it be GPs, practice managers, nurses, also have access to this report if you wish. So if we go ahead and click on Enable Editing, we can now edit this report. So I may want to do a targeted QI activity on focusing only on bowel cancer screening for women aged 50 to 74. So what I will do is click on row 2, just like this. So the whole row is highlighted. I will then click on Data, and I'll then click on Filter, just like this. I will then say, only show me patients who are eligible for bowel cancer screening. I'll then show, if I want to do a target intervention for this activity, I want to target women aged between 50 to 59. So what I'll do is select age. I don't want to include all ages, rather only females aged 50 to 59. So I'll select those ages, just like this. And now all I see is a list of females who are eligible for bowel screening, who are aged between 50 to 59. From that, I can also sort by GP to see what GPs are these patients' normal GP also. That is the Primary Sense demonstration for bowel and breast cancer screening.